Welcome to The Explainer. Today we're tackling a huge, critical breakdown in healthcare. But here's the thing. It's not a failure of medicine or doctors or nurses. It's a failure of access. It's about all those moments when people desperately need care but just can't get to it. Let's dive right in.
To think about that for a second, it's such a simple idea, but it's so incredibly profound. Because for millions of people, that moment of need, that real crisis, it almost never happens during convenient business hours. It happens when the system is, for all intents and purposes, asleep. And this isn't some theory. No, it's a daily reality. And it's exactly where our story begins.
So, what does it actually look like when access breaks down? Well, it looks like thousands and thousands of individual stories of failure. Stories that are happening right now, every single day, all across the continent. Let's take a look at just a few of them.
Okay, picture this. It's 2 o'clock in the morning in Nigeria. A woman named Amina wakes up. Her breathing is tight, she can't catch her breath. Something is seriously wrong. But the clinic? It doesn't open for hours. She has to think about finding transport, the cost of it in the middle of the night, and she's forced to make a choice that so many people have to make. She waits. And this, right here, is the absolute heart of the issue. By the time morning comes, of course, her condition is worse. The clinic was there, the medicine was there, the doctors were probably not far away. But the access to that care, it just wasn't there. The system failed in that gap, in those critical, agonizing hours of waiting.
Now let's jump over to Kenya. This is David. His son depends on medication he has to take every single day. But it's a Sunday afternoon, and they've just run out. The local pharmacy is locked up tight. The next closest one is miles and miles away. So he tells himself, it's okay, it can wait till tomorrow. But we all know, in healthcare, waiting until tomorrow is always a gamble.
Or how about Thandi in South Africa? She manages to leave work a little early, just so she can get her prescription refilled. But she gets to the pharmacy, and what does she see? A massive, slow-moving queue. She waits, and finally, she just gives up. She leaves. Not because she doesn't desperately need that medicine, but because the barrier to actually getting it just felt impossibly high. And our last story is from Ghana. This is Kojo. His mother really needs to get to a follow-up appointment. But Kojo has to weigh all the factors. The cost of a bus ticket, the time he has to take off work, the pure exhaustion of the journey itself. And he makes a tough call. He postpones it. It's not because he doesn't care. It's a decision that was literally forced on him by all the friction in the system.
Are you starting to see the pattern here? We've gone from Nigeria to Kenya to South Africa to Ghana. Totally different people, totally different situations, but the outcome is exactly the same. The breaking point wasn't a lack of medicine or a doctor's skill. The care broke outside the clinic walls. It was a complete failure of access.
Now, what's so powerful about this is that these aren't just one-off stories. They're not just anecdotes. No, they are symptoms of a much bigger, systemic problem. One that's backed up by a whole lot of evidence.
You know, you look at research from big institutions like the World Health Organization, and they confirm everything these stories just showed us. The data is clear. Delays in getting care directly and negatively impact health outcomes. I mean, some studies show that for certain urgent conditions, the mortality rate can increase by up to 8% for every single hour of delay. And it's common sense, really. The further away something is, the more it costs, the longer it takes, the less likely you are to go. This leads to missed treatments, people not taking their medicine, and, even with this boom in private healthcare, these exact same access gaps are still there, hurting everyone.
Okay, so if the big problem is access, you might think the solution is simple, right? Just keep the clinics open longer. But that only kind of patches over the problem. What if we need to completely rethink the whole model?
And this right here, this is the shift in thinking that changes everything. Instead of just trying to stretch the old broken system, the real lasting solution is to build a new one. One where those old constraints, like opening hours and physical distance, they just don't matter anymore.
And this is exactly where a platform like AfriPharm Health comes into the picture. It's designed from the ground up to create a seamless, connected flow of care. A flow that begins way before a patient ever steps foot in a hospital and continues long after they've gone home.
So how does it work? Well, it's all about integration. It weaves together 5 crucial networks. You've got your hospitals, your pharmacies, your emergency responders, virtual telehealth providers, and even home care services. They're all connected. This creates this incredible ecosystem where care can be delivered where it's needed, when it's needed, effectively tearing down those old physical walls.
Now, if you're a healthcare provider, the benefits here are huge, and they're immediate. Just imagine less pressure on your waiting rooms, a much smoother flow of patients without having to spend a fortune on new buildings. You get this amazing continuity of care because you're always connected to your patient's journey. And on top of all that, you get access to real-time data that helps you make faster, better decisions.
So, let's go back. Let's revisit those stories we heard earlier and see how this new reality just completely changes the game. This is where you can really see the impact.
Remember Amina, waiting all night in Nigeria, struggling to breathe? In this new reality, she doesn't wait. At 2 a.m., she opens an app. She connects with a virtual care provider instantly. Her care starts the moment she needs it, not 6 hours later.
And David in Kenya, staring at that empty pill bottle on a Sunday? Well, through the connected pharmacy network, his son's prescription is refilled and delivered right to his door. That crucial, life-saving flow of medication, it is never broken.
And Sandy, in South Africa, she doesn't have to choose between her job and her health anymore. Her prescription gets processed digitally, she can swing by and pick it up in 2 minutes, or heck, even have it delivered. The queue is just gone.
And finally, Kojo in Ghana. He can make sure his mother gets that vital follow-up care, either through a home care visit or a virtual appointment. Suddenly, distance isn't the barrier that forces him into making an impossible choice.
And that's really the bottom line here. We have to stop thinking about access as some kind of nice to have, a simple convenience. It's not. In millions of situations every single day, it is the only thing that matters. It's the switch that determines whether care actually happens or whether it fails completely.
So that leaves us with one really fundamental question for every single person who works in healthcare. When your doors are closed, when the distance is just too far, when the line is too long, what's your answer? What happens to that patient who needs you right then, in that gap?
With a truly connected system, the answer finally changes. Because when you build care around the patient, instead of around a building, it never, ever has to stop. It's how we close these gaps for good and build a system where care is always within reach.